So the aim of this webinar is to explore some of the multiple initiatives which are present across the globe on engaging young people on the issue of antimicrobial resistance. And we have today here 7 unique initiatives which are presenting details of their work, followed by a panel discussion with experts on expectations from such initiatives and ensuring their scale up. To begin with, I invite Dr. Sujit Sandhi, Director of React Asia Pacific, to give an introduction on the need for prioritizing young people in antimicrobial resistance. Over to you, Dr. Sujit.
Thank you very much, Shruti, and thank you to the panelists for taking time to be here with us, and most importantly, to our youth, if I can put it that way. Some of us have gray hair, but we still think we are youth because we've all gone through experiences in different ages. But why are we here really? And I think there's 2 aspects to this. The first aspect is, of course, the issue of the great discovery of antimicrobials and antibiotics, but the fact that we've been misusing it, inappropriately using it, excessively using it, and therefore the bugs have fought back, leading to the phenomenon of resistance and the ineffectiveness of many of the antibiotics that were so commonly used. So there's that aspect of the urgency of what we are dealing with, the importance from a public health point of view. And as you can see, it's not just about infections, but many a time, even for cancer chemotherapy, or when you have another procedure, an organ transplant, we tend to have a risk of infection, and there has to be an antibiotic or an antimicrobial which needs to be effective. So this has wide implications. But why prioritize the youth? So for that, I'm basically a teacher. Even though I'm a doctor, I teach at a medical college in South India, for those who are not from India. And one of the things I've often found about students is the fact that they're full of ideas. But we need to formulate those ideas in a way so that they form habits, attitudes, and above all, certain principles and ethos by the time you become adults. And also remember that you're going to be leaders of the community in whichever profession you are. So it's very important that certain things are learned in school and in college. And I still remember when I was in primary, secondary school, we were taught how to cross a road. And the mantra or the catchphrase at that time, and it probably still is, stop, look, and listen. But how many of us were actually taught that in our school, or have we learned it along the way, or we're still ignorant of how to cross the road? It can save our life. Similarly, simple equations like P1 V1 is equal to P2 V2, or something in a different dimension entirely. How do we practically apply it? Do we, when we cook a meal, let's say it's rice, and you're putting it in a pressure cooker, there is pressure, there is volume, and there is temperature. And how do you relate it? So all these practical applications of what we learn in school need to come into our life. But unfortunately, we all know, and especially in many countries where there is rota learning and memory-based learning, that principles, attitudes, and others are often given a secondary role, whereas the primary aim of most students and schools often is to actually pass the exam. And at the end, are we ready for life? So here we have, therefore, that kind of a scenario vis-a-vis the AMR or antibiotic resistance scenario. So how do we incorporate the two so that we are ready to tackle antibiotic resistance, how to properly use medicines and especially antibiotics for us and for the community around us, and for those of us who later might get into a medical profession when we prescribe or dispense or administer these antibiotics. Because you and I know that soon we'll be running out of effective antibiotics. So this is why we are here, because you as youth will be the leaders of tomorrow. And if you're on board, you have your core principles of hygiene, of medicine use, of knowledge and awareness about antibiotics and the consequences of misuse ingrained in you, you'll be ready to practice that in your life. You'll be ready to tell the community around, your family, and most importantly, you'll be ready to be good advocates of the issue that we're going to talk about. So I'm so happy that all of you have taken the time off here, because it's going to be of great value. And I'm so happy that the panelists here, experts in their own right in various fields, are here to talk about their experiences and their valuable lessons. I hope you'll be able to inculcate it in your life, in your school, in your college, and in your profession. Thank you very much.
Thank you, Dr. Sujit, for that introduction. Next, we have our presentations from each of our invited youth initiatives explaining their work in engaging young people on AMR. To begin with, as first presenter, we have Mr. Michael Mosha, Project Coordinator and Acting CEO of the Rollback Antimicrobial Resistance Initiative based out of Tanzania. Mr. Michael, over to you.
Hi everyone. So I'll be sharing our best practices, what we do here in Tanzania. So we believe that changing people's behavior is not easy, and the older a person is, the more they are set in their ways. And we engage with several stakeholders, including the school children and several schools here in Dodoma. So school children are in the formative ways, in the formative years, so which is the right time to teach them about AMR. And so imparting knowledge on these children will have a larger impact later on, because they are the future stakeholders, they are the future policy makers, future healthcare providers, and so it's effective investing in them. So importantly, students have got links with families and communities back home. They've got their own relatives and so on. So by training students, this will enable them to train their family members and educate their neighborhoods. So this has been very practical in our settings. The methodology used here through AMR school clubs, the RIB initiative used different methodologies to engage students on AMR. These are classroom teachings. We have arts and crafts like songs. They create songs, both traditional and local songs, skits, dramas, traditional dances, and storytelling. So they create this, and then we context them in the AMR context, and it has been so effective in addressing the global threat. However, the motivation for active participation was encouraged through AMR crafts and competition, whereby the winners of these competitions were to be given a present. So there were 3 schools. Both of them were secondary schools. I mean, all of them were secondary schools. So whereby the winner was to be given a present after winning this AMR competition, either through songs, skits, dramas, and traditional songs. As you can see here, figure number 1 shows trained AMR champions using a Swahili song to raise AMR, and the figure number 2 using drama to raise AMR awareness. However, the traditional dances and the figure number 4, these are the classroom teachings. All of these are the methodologies whereby we use them to educate the children. We believe that through these methodologies, it has been fun to educate students rather than just having classroom teachings, which is a common way or a more formative way of learning. But through traditional dances, skits, and dramas, in short, arts and craft will be funnier and very engageful. However, we involve parents On your left-hand side, we can see parents workshop. The parents are engaged to see what their children are doing back at school. And however, when they go back home, these children educate their parents and relatives on the consequences of AMR and what it is. On the right-hand side, after their completion of these courses, they are given the certificates of attaining the AMR lessons. The success, the RBA initiative built a capacity of 322 students from 2020 to 2022 through RBA initiative AMR School Club project. These trained students have since delivered AMR messages to over 11,000 fellow school children. This has been through morning speeches. These children also, when they go back home, they do the Balozi campaign, whereby the RBA, we have been providing support to these children through providing them the essential flyers with simple AMR messages and the necessary letters that require them to engage in the community. So lessons learned is that RBA initiative realized there's a challenge of wash, and through AMR RBA competition winner, we built a tank, a washing infrastructure to the school club winner. As you can see there, the children are enjoying the washing infrastructure after winning the AMR competition that was in 2022. And yes, that's all. In conclusion, is that if young people are engaged and empowered, they can increase community knowledge and awareness about AMR as change agents contributing to the National Action Plan on AMR. As we said earlier, these children are in their formative ways. So this is the opportunity that we can use to educate this youth, and so on. Later on, we have this generation that can combat this problem more easily. However, approach that address health from an integrated perspective, that is One Health approach, has been incorporated in teaching these young students, and so it has been effective in addressing this global threat. Thank you so much.
Thank you so much, Mr. Michael, for that very crisp and clear presentation. Next, we have Dr. Ponnari, co-lead of the Superheroes Against Superbugs initiative, which is centered in India. Dr. Ponnari, over to you.
Thank you, Shruti. Hello, everyone. I'm Ponnari, and I'm co-lead at Superheroes Against Superbugs initiative. So this is an initiative that was launched in 2018 in India. And our mission is to create a platform to initiate conversations and public action to tackle AMR in India. And we do this by partnering with young children, by empowering them with knowledge of antibiotic resistance and making them creative partners in raising awareness about its parents. We also aim to encourage scientists and medical professionals to engage with the society at large on AMR and also on science and health in general. And we work with young children because at SAS, we believe that young minds are capable of bringing about transformative change when they're equipped with the right tools. Over the years, we have worked with children of different age groups, from children as young as 10-year-olds to adults. But our main target audience is between 13 and 15-year-old children, because we believe that at that age, they are not only capable of understanding the complexities of AMR, but that they're also capable of influencing behaviors around them. So that is our main target audience in most of our workshops. Our motto at SAS is that everyone has a role to play in tackling antibiotic resistance, and this is the message that we try to imbibe in our participants. Our main mode of functioning has been workshops. And because we work with young school-going children, we combine innovative science education approaches with novel public engagement tools. So we inform these children about the science behind AMR through creative and fun hands-on activities and interactive games. We also discuss the effects of AMR on their families and their communities. We talk about the environmental implications of AMR. We talk about the also the how it personally affects them and their families as well. And we also provide a platform for interaction with different stakeholders like scientists and doctors. At the same time, we also give them exercises where they go back home and talk to their parents about antibiotic usage in their own households. Also talk about, see how antibiotics are dispensed in their local pharmacies, with the idea that these kind of exercises help them to solicit their own experiences, and they're able to sort of understand the behavioral patterns around misuse of antibiotics in their own communities. So once they are informed, once they're equipped with knowledge on the issue, then we encourage them to come up with their own stories around the issue, and then talk about, use different creative mediums like grassroots comics and skits and podcasts to narrate their stories. So what you see here are grassroots comics. These are simple black and white comics that these children have drawn on different concepts of AMR. And this is a very innovative, this is a very powerful tool, because these are unique messages from these children to the world on AMR. And because these are drawn by the children themselves, there's a sense of ownership. And when they talk to the parents, the communities using these comics, then because the community know these children, there's also sort of a personal connect, and that kind of helps them connect with the issue, more deeply. So this is a very powerful tool, and we actually collaborate with Mr. Sharad Sharma from World Comics India for these comics. So over the years, we've come up with a large variety of educational resources, which are interactive games and activities, and these use simple materials. They can be very easily adapted anywhere because they don't cost much, and these are very easily available materials. The participants of our workshops have come out with a number of engagement resources, comic skits. We've developed an animation inspired by the comics drawn by the children. And these are all freely available on our website for others to use. And of course, we've empowered young change makers who are now taking the message into their schools, homes, and communities. We've recently launched a fellowship core program. Our first edition had 3 fellows, 1 science educator, 1 science communicator, and 1 a veterinary researcher. And because they come from different backgrounds, they have very different approaches, and they're adding to our educational resources. Also, we're trying to build a community of AMR champions through these other people that we involve in our workshops, with the researchers, medical professionals, artists, and technologists. The number of challenges when we interact with young children on AMR, like how do we convey the complexity of AMR? How do we make the problem relatable to children? There's always the question of misinformation, and how do we convey the scale and urgency of the problem without actually overwhelming the children? And over the years, we've seen that some of our approaches work well to tackle these issues, like simple games and activities help simplify the concepts for them. Visual tools and art give them an immersive experience, and soliciting their own personal experiences helps them to relate to the problem. And one important lesson from our experience is that it is important to tailor the workshops based on socioeconomic differences, because different people relate to the problem differently. And we always leave these children with a call to action at an individual level, because we want these children to feel that there is something that they can do to tackle the issue, rather than get overwhelmed by the by the complexity of the large issue. So with that, thank you. That's our team and collaborators, and these are our social media handles. Thank you very much.
Thank you, Dr. Ponnari, for that very informative presentation. So next we have our presentation is from the Youth Against AMR Initiative. We have 2 representatives. One is Phong Bao from Vietnam and Stutika Shrestha from Nepal. Both of them will be explaining regarding the initiative. Stutika, yes, okay.
Good evening, everyone. My name is Phương, and I'm from Vietnam. Today, I and Stutika from Nepal will represent young members to introduce our project to you guys. Youth Against Antimicrobial Resistance, or we usually call YAR for short, started in mid-September 2020 and brought together 5 teams working across 4 countries: Vietnam, Nepal, Thailand, and Kenya. This project had 2 phases. In phase 1, our projects aim to bring together young people from 4 countries in the Global South to help combat the challenge of antimicrobial resistance or drug-resistant infection. We wanted to understand level of awareness and knowledge of AMR among children and young people in 4 countries of Southeast Asia and Africa. Moreover, young people across the Global South collaborated to create effective platforms and approaches to engage children and youth as well as co-create messages and engagement activity about AMR. And from other activities in phase 1, we developed a progressive AMR learning framework for children and young people. So, how young people involved in this project? In each country, the YAR project coordinators have established youth working groups comprising of 8 to 12 young people, and I was honored to become a member of the youth working group in Vietnam. We met weekly over 4 to 5 weeks to work on project activities and outputs like the survey development, translations and language use, the content for the 4-level films, and review of survey results. We also conducted peer-to-peer surveys and disseminated the online survey through our social media networks to reach as many young people as we could. Moreover, we had learning sections with local experts and worked together to design engagement implemented at World Antimicrobial Awareness Week. As a result, the social media engagement reached 523,955 young people in Africa and Asia in 1 week through meme, cartoons, short films, slogan competition, photo competition, and so on. And after the activity, we sat together and gave feedbacks on the project, language, and the AMR learning framework. Here you can see the picture of some of our social media activity. If you wanted to know more about our work, you can visit us at our website, youthagainsamr.com. And next will be Stutika's presentation.
Namaste, good evening, good afternoon, everyone. I'm Stutika Tapasrista from Nepal, and I'm an active member of Youth Working Group member in YAR, Nepal. So far in this project, we have conducted surveys either online or door-to-door and evaluated the knowledge of people on antibiotics uses. Along with that, we have counseled them about the concept of AMR and recorded positive response from the locals. Along with the achievements, our group has faced certain difficulties and challenges on conducting the webinar and surveys. So first thing, most of the youths who were working under our group were either studying or working, which grew a problem in setting time for webinar. It was quite uneasy to get online data and teaching as well. Furthermore, collaborating with aged people and younger ones about antimicrobial resistance and the proper uses of antibiotics was not easy because they were hearing it for the very first time. Due to different time zones in our participant countries, Vietnam, Nepal, Thailand, and Kenya, it was a bit problematic to be organizing a webinar with all the participant countries. Apart from the challenges, both the youth working group members and the youth advising group members, we have tried our ultimate best to achieve the objectives we have set before. But for further efficient project, we would like to give some more recommendations. So first thing first, we believe multimedia to be the strongest idea to teach any people of any age group about what the concept of antimicrobial resistance is, what can it cause, and what can be its adversities in the coming world and coming time. So teaching through photos, videos, and animation is the best idea. Then youth must be really active and responsible to spread awareness regarding this problem, including AMR in school curriculum, enabling its teaching in formal and informal ways will be providing best help in the future. And today we call upon every youth for awareing people around them about the antimicrobial resistance. And tonight at Today, we stand against antimicrobial resistance. So thank you for your attention. You can visit our official YAR website and find more information. Thank you.
Thank you. Thank you so much, Stutika and Form, on explaining regarding the Youth Against AMR initiative. Next, we have Ms. Silvina Alicio, coordinator of the Alforja Educativa initiative, which is based from Ecuador. Silvina, over to you.
Yes, thank you. Well, I don't speak English, but I will try to read. Thank you very much for this opportunity to share the Alforja with you. REACT Latin America and the Child to Child from Cuenca, Ecuador, came together 10 years ago to build the Alforja Educativa. The Alforja is an educational didactic toolbox for promoting health with children, especially issues related to antibiotic resistance. The Alforja seeks a real participation of children in health issues and promote the role of children as agents of change for their own health, that their families and communities. The activities were carried out in Ecuador, Argentina, Peru, Bolivia, El Salvador, Guatemala, Kenya, and now in Brazil. The Alforja is made up of different teaching materials for teachers and children. Activity books with the child-to-child methodology, songs, stories, comics, videos. Some materials are in English. Objectives of the Alforja Educativa. Paradigm shift. Human health is the result of the health of the planet. Discover and learn about the connections between human and the microbial world. Analysis AMR from comprehensive view, its relationship with self-medication, food production, infectious diseases. Children as agents of change, favor process of children participation and empowerment, developing empathy and a critical attitudes. To reach the objectives, the project has different lines of action with teachers and children. Training to trainers, workshop with teachers on the use of the Alforja. Participation of children, workshop with children with information, learning with experiments, games, art, development of projects. With topics on access to water and hands washing, microbes, health eating, antimicrobial resistance. Children can express that they have learned, discuss, and created actions. These are examples of activities carried out. Some challenges. We work together with teachers so that they can build their educational project with the Alforja, adapting it to their project, subject, and the children's learning. We also seek to spread the Alforja among the education and health directors so that they can learn about the importance of this topic and allow spaces for training and projects. Thank you. Gracias.
Thank you so much for that presentation. Our next session or our next presentation will be by Daniel Varungi. He's the founder of the Students Against Superbugs Africa initiative. Daniel?
Yeah, thank you so much, Shruti. Maybe are you able to make me a co-host so that I'm able to share my screen?
1 second. Sylvania, can you, yes. Please try now if you're able to.
Okay, yeah, so it's okay. So just a minute. Okay, are you able to see my screen? Is the screen visible?
It's coming online only. Yes, it's visible now. Yeah, perfect.
Okay, thank you so much, Shruti, for the opportunity. So I'll not take so much time because it's just some few minutes. Yeah. So my name is Daniel Orenke. I serve as the head of programs for Students Against Superbugs Africa, and I'm also the co-founder. So Students Against Superbugs Africa, we refer ourselves mostly as SES Africa. It's a catalytic organization, and most of our work is oriented towards building a movement of empowered young students and young people who can advocate and engage actively in the fight against AMR. And this is in their respective niches and strength areas. So our primary setting is in Kenya, but our team hails from different countries and our programs target different countries within the African continent. So our approach in creating change, so as I've said, we mostly engage as a catalyst. So what we mainly do and what most of our programs are focused on is empowering these young people, especially tertiary level students and also early career professionals. These are recent graduates. So that's how we design our programs. And the aim is to trigger the interest, equip them with appropriate skills, and also encourage them either to pursue careers in AMR or even in their careers that they pursue, they're able to bring in an aspect of AMR and advocate for it, or pursue further studies that can help them act more effectively on AMR. Yeah. So we have so our work is programmatic. We have different programs. One of our programs is the AMR Leadership Program for tertiary level students in Africa, which is a collaborative program with React Africa. So we have done a lot on the program, but I won't go into the details. This year we had a research training, and we also had a competition, which was also a collaborative with FAO and also World Animal Protection. We also have an emeritus program, which the main goal is seeking to also educate these young tertiary level students and also early career professionals in research, article writing, and other aspects of knowledge development, so that at least they're able to contribute more knowledge to AMR and also critique the existing knowledge. So we completed phase 1 and we'll be starting phase 2 soon. Evaluation is ongoing in that program. So we also have the My Turn annual AMR exhibition conference. This is an annual conference and it's a collaborative program too with React Africa. So last year we had the first pilot in Kenya. This year we hope to have it in Uganda. And the aim here is really to showcase the immense potential of these different young people, bring them together so that they're able to network and also trigger creativity and innovative interventions. We also have a drug research and discovery program, still under the same catalytic focus to expose and trigger interest of young people in pursuing further education and early careers that are affiliated to drug research and discovery. We are soon going to launch an AMR Ambassadors program, which will be an add-on to the AMR Leaders program. And here the main aim is trying to see whether we can bring on board other students who are not within the health sciences stream and see whether how we can really shape multidisciplinary engagement in AMR work and also promote grassroots interventions, that is empower students at their local levels on how they can drive change. We also launched a documentary soon, and we're working on doing another more refined documentary we have an existing AMR education video series, which is easily available. This year in June, we also launched a pilot game. So we are still planning about its distribution to the target audience, which is mainly secondary and tertiary level students in Africa. And we're also going to evaluate with the pilot evaluation being in Uganda to see how we can improve the game and also maybe refine it further so that its uptake among the target group increases. We also hope to collaborate with a group in Nepal where we also hope to test the game. So we also engage mostly in the communities. So we haven't had a so most of them are usually campaigns, especially on AMR, antimicrobial use, and also WASH. And we're also working on a pilot program which will focus more on rural areas of Kenya. We have identified a target setting and in the final stretch of developing the plan. So we're working in partnership with another organization on this. So we engage also in our activities from 2020, 2021, and 2022. We have done quite a lot. Still, and mostly this is mainly on competitions to increase engagement of these young people and also to create mass awareness on AMR. So we have had some early successes because we have realized that we are building that movement of young people in Africa. So the first picture is a team from Zambia. The second is a student who actually engaged in one of our programs and went on to start a project in Tanzania. So that is a student who was featured by the university in a special bulletin for the work that they did, and quite some amazing work in Nigeria. We have some lady in Uganda and another in Nigeria who are working very much on a podcast. We also have some students who are currently attending a conference. So at least you've seen that have been a lot of active engagement among these young people. So mainly our expected outcome is building a sustainable, multidisciplinary movement of empowered young people in Africa who can passionately advocate for the AMR agenda in their different capacities, interests, and niches, depending on where the interest lies. So we empower people depending on their strength areas. The main challenge, I think, has been lack of trust and also undermining the capacity that young people have in terms of, delivery on AMR mitigation measures. So that's it. Thank you so much for the opportunity. And we are welcome to any questions. And we also shared resources so they can easily be accessed by the chat box. I think Shruti will share. So thanks so much, everyone, and enjoy the session. Thank you.
Thank you, Daniel. I have actually, like he mentioned, been sharing resources in the chat box. So attendees, please have a look at the resources. I think I've shared for the previous 2 to 3 initiatives. Kindly have a look at that. And also, I hope the attending students and experts are finding these sessions enlightening as to the various ways in which students or youth can engage in the issue of antimicrobial resistance. So coming to our next presentation, we have our next presentation by the ASPIC initiative, which is the Antibiotic Stewardship and Prevention of Infection in Communities, which will be given by Mr. Vishal San, who is a consultant at REACT Asia Pacific. Over to you, Mr. Vishal.
Thank you, Shruti, for that introduction. I'll be just sharing my screen now. Hope my screen is visible.
Yes, it's visible.
Yes, okay, thank you. So once again, greeting to everyone from the ASPIC Clubs network. So it has, I think, been a wonderful round of presentations from various student engagement initiatives on AMR. And we would just like to take a few minutes of your time to present on various activities and initiatives come out by the ASPIC network. So as mentioned in the slide, this is basically an antibiotic stewardship program focused on students in colleges and universities. Mainly, we are engaging with tertiary level students who are doing their undergraduation and post-graduation in various institutions. So ASPIC Clubs was initiated in the year 2018 And for the past 4 years, we have been engaging with students from various backgrounds on the theme of AMR and also infection prevention. And currently we are established in 16 different educational institutions in the region within India. And also we have the clubs established within these educational institutions with student representatives and also faculty advisors who are responsible for formulation of various programs and interventions with respect to AMR and infection prevention. So some of the objectives and approaches that we have taken in regard to engaging students on AMR is mobilizing wider societal participation in relation to AMR and also promoting infection prevention measures and appropriate use of medicine communities. So we are mainly looking to do this through various public awareness campaigns and other interventions and also on the ground community programs. So the whole idea is to see whether we can sort of complement them more of say top level approaches that are happening now with more sustainable solutions from a bottoms up approach. These are some of the activities that we have been conducting in the past few years in regard to youth engagement in AMR. So obviously, while we called Antimicrobial Awareness Week is time when most, I think, any organization working in the domain is very active in terms of awareness campaigns and so on. So we have had various competition, podcasts, awareness booth campaigns all going during this time. And also we have on the ground awareness sessions being taken by ASPIC members in terms of in regard to antibiotic use or the rational use of antibiotics and so on, which are mainly say promoted in the form of small workshops or campaigns within colleges or even in communities. And also ASPIC Clubs has taken the lead to also highlight various public health concerns or other locally relevant communicable diseases in their respective settings. So this is a small gist of the different kind of activities that the ASPIC Clubs have been doing. And we also have been providing various small grants in the form of seed funds to these clubs established in different education institutions for conducting small workshops or seminars, or even grassroots level programs in communities. Even some of our clubs have had taken up the challenge of working in flood affected areas where they have done hygiene drives and also sensitization on appropriate use of antibiotics in the AMR and so on. So various hygiene drives or wash interventions and also AMR awareness campaigns have been formulated through the seed funded assistance. So through the ASPIC network, we are basically looking at the expansion or collaboration with other partners or civil society actors in the region, and also more importantly, associating with other student networks in the region also. So for various programs, we had involvement from networks like MSAI, IBSA, and other centers for One Health in various universities in the country. So kind of reaching out to other networks and seeing how we can more efficiently mainstream AMR or highlight the issue of AMR and other related issues is what we've been trying to do. So talking about some of our best practices, we've been actually running a lot of student competition in the past few years. And one of the more popular ones or successful ones have been student research champions for AMR. Which was calling for various student proposals on antimicrobial resistance. And for this, we have had huge, sort of interest from various students from different countries. And we have had a large number of entries coming in, and small research grants were also provided to these students for continuing their research on AMR. So basically this exercise has been sort of very successful in promoting various research interest in the case of AMR. And also, as mentioned earlier, during WOW Week, we have done various podcast and photography competitions. This actually has helped in engaging to a wider student audience. Most of our members are currently from biosciences or environmental sciences backgrounds. But then these kind of competitions, again, have been helpful in promoting this idea of antibiotic stewardship, maybe to other non-science groups or maybe student groups who don't necessarily deal with antimicrobial resistance within their education background. So these kind of competitions, again, have helped in promoting the issue of AMR to, say, other students from backgrounds also. So one of the current competitions that we are running is scientific poster competition, which mainly deals with antibiotic use in food production systems. This is being done with the support of the Food and Agriculture Organization under the United Nations. And we also have some local partners involved, such as the IAPC and IVC India, helping us out with promoting this competition. So again, the issue of food systems and AMR is sometimes less likely familiar to students, and we are trying to engage students on this issue and see if we can have novel interventions coming in on how to deal with these issues. So this competition is currently ongoing. Anyone who is interested in participating can reach out to us also. And these were also some of the major events that we have been did in the past, webinar series on various topics of aspects of virology, food systems, as earlier mentioned, poverty reduction dimensions within AMR, and so on. Also, we had provided a short course on research laboratory techniques to ASPIC members, where students from microbiology or biosciences background were exposed to various, say, antimicrobial susceptibility testing or other molecular techniques, where they had a hands-on experience in doing various demos, and also which was seen to be very, very helpful in their academic backgrounds. And also we initiated various podcast series on the theme of youth engagement and AMR. And also we have been pretty active on social media in terms of promoting the theme of youth engagement and AMR. And also we've been having annual meetings with all ASPIC members from different institutions for the past years in the form of annual meetings. This has been a very good venue for all the members and students to come together to share their learnings and experiences on various programs and interventions that they have formulated within the ASPIC network for promoting the issue of AMR and also how we can deal with it. And also, as a part of the student engagement initiative, React Asia Pacific and ASPIC clubs, along with various, say, student engagement network and organizations, had also submitted an open letter to WHOEB and also the One Health leaders, global leaders group, whereby calling for a united platform for youth engagement on AMR and possibly the establishment of ring-fenced investment plan to mobilize action on AMR. So this was actually formulated in 2020, and this was almost co-signed by about 25 organizations, and it was submitted to the Director General of WHO. So some of the challenges that we have been facing on the ground in concern to the ASPIC networks involves a high turnover of students. Obviously, these are students doing their post-graduation or other undergraduation programs. So sort of every year we have people moving out and new members coming in, sort of engaging. Continued engagement with these students have been very important, and sort of ensuring that sustained momentum is followed up with all the clubs and the members of the ASPIC network has been some of the challenges that we've been facing. And also we had various resources also formulated from the various programs or events that ASPIC clubs have been doing. We had clubs that had done various videos on AMR, or they have come out with materials in local languages, podcasts done by students, and so on. So all this has, in a way, contributed to highlighting AMR and mainstreaming AMR in various venues. So I think the last 4 years for us engaging with students has been a wonderful time, and we hope to continue doing so. Thank you.
Thank you for that presentation. The final presentation from the student network for today is from the ASPIC Junior Initiative by Dr. Haifa Mohammad Ali, consultant at React Asia Pacific.
Thank you, Shruti. Yeah, all right. So yeah, so ASPIC Student or ASPIC Junior Initiative, it's basically initiative with an objective of expanding the current clubs program to school pupils. Like ASPIC is mostly focusing on college students, so we would like to expand it to the school students. And this was initiated with regard to that objective. So mainly we have, like at present, we are engaging 10 schools in the southern Indian state of Kerala, which we are collaborating with them. So the main objectives are like sustainable intervention and empowering stakeholders. So under sustainable intervention, we're looking forward for identifying optimal approaches to engage an abstract topic like AMR to the children, how to communicate well with them, and also identify sustainable local funding strategies for the clubs to actually being React playing as a catalytic role. We have to be sure about the sustainability factor of the clubs. So under empowering stakeholders, we would like to actually focus at this point more on the teachers and administrators of schools, so like provide support, train, and encourage them to think in a One Health approach by creating context appropriate resources and then synthesize evidences to identify best practices and approaches. So the background work for ASPIC Junior actually began in 2018, where we started with a consultation workshop with school teachers, and we tried to identify the challenges that they're facing in communicating and how can we actually put it together? How can we actually use the existing framework to communicate AMR to the students through the teachers actually? So it started with a workshop where we collected the ideas and came out with a couple of factors which we should be keeping in mind to have a contextualized materials. So based on that, we created 2 manuals. One is like a primary school training manual, and then followed by that, we created a high school training manual for the respective students based on the curricula of the country that we follow. Yeah. So we tried to pilot the manual. We did modifications. We did a couple of adaptations to the existing manual so that it could be more user-friendly and it could communicate the idea better. So other than that, we with COVID, we kind of had a slight hamper in the activities that we were doing. So we came up with a comic book, which was again communicating the broader idea of One Health and how AMR in a comic series. So after that, in 2019, we had a color competition through which we tried to bring out more of like materials that we can use to engage students. So through that, we actually engaged public health students and social medicine students in the state, and we tried to use their ideas and approaches to actually generate more of materials that can be used. And later, once the restrictions were like removed, like we started with a TOT workshop for the teachers, where around 50 teachers attended the workshop that we're holding. And then apart from that, the comic book which we has created, it was translated into 5 languages. And then at present, we are trying to do or extend it to more of like colleges and schools in the area. So basically, these are like the resources that we have created over the past few years after doing extensive ground research and desk researches. So the training manual for both primary and high school, it essentially conveys the larger idea of One Health, general health concepts and well-being. And then it focuses, the subsequent modules would be focusing on AMR and how we can introduce it to the students through teachers. So these manuals are meant for the teachers and not for the students. And they can actually use it in their teaching schedules, and they would be trained to actually, they would be facilitated to, convey to the students. And the comic book series, which we have created, we received a very good positive feedback, and it was actually translated to like 4 other South Indian languages, including the native language of Kerala. And like one classic example would be like, it was taken up by the Church of South India, and around 7,000 copies were printed and circulated in the for the students coming under the School of Church of South India. So that was a very positive approach that we have received, where we could actually modify and contextualize. AMR could be communicated with other topics. And then board games, which we have generated. Then we have short videos, which could be used for communicating with the students, and lots of merchandises that we can actually use while engaging students, like T-shirts or pens that could actually convey small messages about AMR to the students, or calendars which could be hung on the school walls. So some kind of contextualized thing which is culturally appropriate and can communicate well to the students. So these are the resources that we have generated for our purpose of communicating and engaging with school students. So basically, at this point, we're trying to see that how we can adopt these resources that we have based on like existing school curriculum. So, and we're trying to see how it can increase the AMR and One Health awareness among teachers, and then also like identify multiple approaches to include the concepts of existing curriculum and academic schedules. So at the end of the day, we're just trying to see how can we utilize the trainers to convey the messages to the students in a better way, and use this current framework that is, without not making a lot of alteration in the existing framework. So it can improve the understanding of AMR issue at an early level among students. Once, if you engage teachers in the right sense, they could communicate it to the students, and that could actually create a sustainable behavioral change in the community. So another factor we would be focusing more would be like contextualizing the resources and emphasize on local language. So when we piloted the initial time of the training materials among students, we found that it has to be communicated well in the local language to actually understand an abstract idea like AMR. So we're trying to emphasize that part a lot, like communicating with a highlight on the localization, contextualization, without having a lot of jargons, and trying to use the simplest term to communicate it with them. So using a local language and being culturally appropriate and sensitive, it caters to a larger audience, and it can generate significant student engagement. Yeah, so this can increase awareness among students, leading to a sustainable behavioral change in the communities. So in the subsequent years, we're looking forward for more of like a student-driven strategy. At this point, we are focusing more on a system-driven approach, where the teachers would be communicated well about the ideas, and they would be communicating to the students. Like, for example, a system in the school where there is a science club. The science club could adopt, strategies like, for example, a wash approach, and they can come up with a session on hand washing or how to make soaps, and through which we could communicate hand hygiene. So it's mostly driven through the teachers or the trainers or the school administrators. So in the subsequent years, we would like to see more of a student-driven approaches, and also like more of innovative strategies, unique ideas, where how can we have the curriculum of AMR and One Health to be prioritized in the academic curriculum of the institutions that we are catering to. And also we would like to explore more like implementation partners and funding sources to make this more of a sustainable approach, which we have just begun with 10 institutions. We would like to see how it can go beyond the 10 institutions. And yeah, so that is more of what we're trying to do in ASPIC Junior. It's a very, in an initial phase, we're trying to synthesize more evidence and approaches for best practices. So we're more looking for like expanding it in the upcoming years. Thank you. And to find more details about it, you can use any of these links. Thank you.
Thank you, Dr. Haifa. Now that the 7 student initiatives have completed their presentations, we'll be moving on to the panel discussion on the topic role of youth in AMR containment and ensuring scale-up. So this session will be moderated by Dr. Philip Matthew, AMR advisor at ICAS. And as panelists, I invite Dr. Roger Harrison from the University of Manchester, Mr. Thomas Joseph from the World Health Organization, Dr. Alex Costa from UNICEF, Ms. Sean Williams from Wellcome Trust, and Dr. Anthony So from REACT Strategic Policy Program and Johns Hopkins University. To the attendees, please feel free to put in your questions to the panelists in the Q&A box, and we'll be answering some of them towards the end. Over to you, Dr. Phil.
Thank you so much, Shruti, for that, for those wonderful 7 presentations on
on different approaches for youth engagement, or rather engaging young people on antimicrobial resistance. I think when we were planning this webinar, our idea was to actually start with all these various examples of innovation and then move on to perspectives of people who shape the AMR landscape globally. So we have a fantastic panel today. I'll just briefly introduce the panelists here. We have Dr. Thomas Joseph from the WHO headquarters. He is heading the AMR Awareness and Stewardship unit at WHO Geneva. He has a history of working extensively in TB and HIV, and also has got expertise in community engagement. He has been a part of global organizations like CARE, ActionAid, and also WHO in the past. He, apart from being a public health specialist, he has also expertise in agri-economics and also international development. Dr. Anthony So is a professor of practice and the director of IDEA Initiative at Johns Hopkins Bloomberg School of Public Health. In the past, he also heads the REACT's strategic policy program. He has also been a part of the US government in the past. He has worked in Duke University, he has been a part of Rockefeller Foundation, worked extensively in tobacco cessation campaigns. Is primarily an internal medicine doctor by training, but later decided to focus on public health. We have Dr. Roger Harrison, who is a faculty from the University of Manchester. He is a public health specialist at the university. Done extensive work in open access learning, has piloted several online courses on AMR and related topics. And his USP here is that he has seeded several youth engagement initiatives all across the globe, especially in Africa. Sean Williams is the senior policy advisor at Wellcome. She has been with the drug-resistant infections team since 2017 and has planned and implemented several exciting initiatives on communicating about AMR and behavioral change around AMR. She has a past of working in global health or rather food security issues, and she identifies herself as a science communicator also. Dr. Alex Costa is a senior health advisor with UNICEF. He is basically a molecular biologist by training and also a public health specialist. He has global experience, especially in Southeast Asian countries, working on antimicrobial resistance and lab strengthening issues. And now as a part of UNICEF is heading all the initiatives around antimicrobial resistance. So I'm very, very happy to have this wonderful panel on board with us today. I can probably start off with Dr. Thomas Joseph from WHO Geneva. Considering his extensive community engagement expertise, I think as we all know, the Interagency Coordination Group on Antimicrobial Resistance had called for a systematic and meaningful engagement of civil society groups. Now that we have heard a lot about civil society-led initiatives to engage young people on AMR, what do you think is the unique value proposition of these initiatives? And do you see any kind of benefit in proposing a global platform to harvest the learnings, than organizing an ad hoc thing like a webinar once in a while? Can we have a global platform to learn from each other and harvest all the learnings? Over to you, Dr. Joseph.
Thank you, Philip. And first of all, congratulations to you and to Shruti and everyone who organized this excellent webinar. The 7 stories that I've heard have really, inspired me actually. And I think each one of them shows how much there is that is being done and how much more can be done. And before I address the question, I just want to say something that I think is important, which is that we had in June and July organized global consultations across the world on AMR awareness. And I think many of you, at least some of you, were there, including Sujit Chandi. The findings were incredible because everybody across the world in these 2 different consultations converged and agreed that the most important audience for AMR and the most important communicators of AMR needs to be the youth, and that's whom we should be targeting. And this is important because there is global consensus on the centrality of youth. That's the first thing that I wanted to say. And I'm so happy that I'm meeting new organizations that I hope I'll be in contact with over the next several years. To the question about civil society and what its role is and how it works and so on, I think there is no question, but if you look at the history of change and significant change, you will find that the valuable position has been occupied by civil society. Now, if you look at, for example, the Young Person's Cry on education, Malala Yousafzai, she has transformed the way everyone thinks about girls' education. If you look at Greta Thunberg, she has transformed the way the world thinks about climate change. And these are very young people, but they also stimulate civil society in the sense that they stimulate citizens to act in a way that they probably wouldn't have had they not had that, as someone said, catalytic impact. But civil society has proven itself in so many spheres, and I don't want to do the whole story of everything, but if you look at just HIV and how the world transformed from having HIV as a curse, as something that was incurable, that people were dying and succumbing to in the hundreds of thousands and so on, to a condition that you can live with, and how civil society pressured the world to ensure that policies, regulations, rules supported human beings in their struggle with the disease, and that investments, research, medicines, etc., became available to everyone, right? Fundamentally, it transformed the relationship between the disease and the human. And this is almost entirely, the huge tribute to civil society for what it was doing. So the civil society has tremendous roles in terms of being able to convene large numbers of people who can start thinking alike from across the world. They are hugely successful at advocacy, doing things that organizations like WHO, that governments cannot do, to pressure governments to make changes to policies and to laws. But they also help to ensure that resources are allocated and to ensure that laws and regulations are promulgated in support of whatever it is that needs to be done, whether it's climate change, whether it is HIV, whether it is TB, whether it is, hopefully in the future, AMR. So they can sort of transform the mindset of entire communities, entire nations, entire globe, in a sense. And I think that's probably where that's why they are so important. As to a platform, I have to share that we are already the quadripartite, which is the World Health Organization, the Food and Agriculture Organization, the World Organization for Animal Health, and the United Nations Environment Program. Together, we call ourselves the quadripartite on AMR because it is a One Health sort of issue. We are working on establishing a partnership platform on AMR. And that partnership platform will bring in stakeholders from across society, whether it's governments, whether it is multilateral organizations, whether it's academia, whether it is civil society organizations. So there is a plan to do this. It is an important plan. And I hope very much that civil society's role in that platform will be to go against the stereotypes, to challenge the existing order, to bring fresh ideas, to push for new initiatives, to ensure that policies and resources are mobilized in favor of the right solutions. So I would certainly say that this is important and that we hope it will happen. And if it is to happen, it will happen in the next several months, not in the next several years. But besides that, the platforms that are already established within REACT and other organizations, I think are tremendous. And I think we should have a burgeoning of multiple platforms, not just one single platform, but platforms across the board. I'll stop for now over there and allow others to contribute.
Thank you so much, Dr. Joseph. I think you're very right. I think civil society has to play a critical role in expanding the AMR landscape and also kind of bringing forward issues that otherwise may be neglected or not really in the focus of the global community. My next question is to Professor Anthony from Johns Hopkins, basically about the large number of initiatives, youth engagement initiatives. Every youth engagement initiative is unique. We've heard from the presentation, there are different approaches being tried out, there are different activities being tried out, but all of them want to kind of sensitize students or young people around antimicrobial resistance. Do you think we need a common strategy? Are we spreading ourselves thin, using different approaches, using different methodologies? Is it time to actually consolidate all of that and have a common theory of change across the initiatives, to engage young people across the globe, or is it that you see the diversity is helping in increasing the evidence base for different approaches on the same issue, looking at it from a very multidimensional angle?
Well, thanks so much for the opportunity actually to be part of this panel. And I want to first say what an amazing set of presentations. I thought these were one of the most inspiring set actually presentations focused on youth outreach that I've heard in all my time of working on AMR. So hats off to all of the groups involved. And this was really extraordinary. I think there are obviously common strategies that can be deployed, but oftentimes actually we need to really think more actively about the particular targets of how we're going to create change. And it's interesting, when you look at the breadth of actually the presentations given, you can appreciate the remarkable richness that they actually start to approach these issues. So for example, there are several key questions when we talk about theory of change. And when we say theory of change, I certainly, when we talk about actually testing a hypothesis. If A, then B follows. It's about predicting how change will occur. That not only allows you to be accountable for the results, but also makes your results more credible because they can be predicted to occur in a certain way. And that's what we mean by theory of change when we actually teach about it here. And there are several questions about the projects that actually conduct education outreach. There are several layers. Is it, for example, to educate those carrying out the project? That's one level. A second level is to educate or transform those reached by the project, the target audience, right? Or does it speak to trying to accomplish more systemic change on AMR, the advocacy end? And I heard just an extraordinary actually richness of detail as you walk through the various projects. You had Micah Moshe talking about actually educating communities through children in their formative years, through arts and drama, engaging their parents, 2 levels very clearly, right? And ownership of stories, actually, in Dr. Panari's actually efforts. Similarly, the Youth Against AMR, the Fora Educativa, and some of the, of course, the other projects actually that focus on children really as agents of change. And then you had, of course, a second set of projects, more particularly towards the end of the presentation, said that Students Against Superbugs and actually the ASPIC clubs, which take a little more of an advocacy approach. They actually are also perhaps a little more advanced in their stage of education and their targets. So we shouldn't think of youth engagement as simply something monolithic. It's the diversity that actually of these various approaches that gives it strength. So, in fact, we shouldn't invest also all of the efforts just on youth. After all, they didn't create most of this problem. Unfortunately, it's our generation that left them with this problem. So I think we need to clean up some of the mess ourselves and hope to train the next generation to do a better job. But they also might focus on new targets. For example, we need safe food practices in wet markets. We need the use of to target the use of antibiotics as growth promoters in farming. Whether our grocery store chains actually are buying food animal products that are raised with the responsible use of antimicrobials. These are new potential targets. And some of these youth engagement groups could actually even go further in evolving, I would say, the theory of change to actually incorporate some of these other approaches of advocacy that I think clearly are also other targets. Now, youth are not always the best engaged necessarily to target actually to create a theory of change. So I do think it's very strategic for a lot of the educational programs, for example, to work on wash interventions, because that's something well within their reach. But you're going to try to change primary care physician prescribing behavior. That's not necessarily their responsibility or their greatest point of leverage. And so we shouldn't necessarily just say it's just one actually group that's responsible for creating awareness into action. A really savvy actually educational approach actually is one that brings the entire village together and actually understands the different roles of different stakeholders. And that's really important in actually evolving also a theory of change. And one of the key things, of course, is the systemic level thinking. How do we actually get these kinds of practices actually embedded into the educational systems in which they reside? So how do we get universities and medical schools to adopt actually this routinely as part of their training? It doesn't require just an extracurricular club, but how does that become part of the core curriculum? How does the Ministry of Education get persuaded to make sure this is part of primary and secondary school education? So how we actually move from if A, then B, that will follow, I think is really important to think carefully about. And I think the examples that we had today, of course, before us actually provides a great starting point, but there's so much more that we can do with them. And this is such a promising start to that.
Thank you so much, Professor Anthony. I think you're absolutely right. I think diversity makes it better. And then we should have a set of reasonable expectations from students. What do we expect young people to do in terms of antimicrobial resistance action? Next question.
Just a few additional resources I'll put into the chat. One of them is actually, how does one actually sort of do continuous quality improvement on one's own actually theory of change? So I'll put a manual on theory of change in the chat. And there's another actually, of course, approach we teach actually in our school, in our university, called actually the Fogg behavior model, which comes from Stanford, which actually looks at actually how you unpack actually your educational intervention between motivation, ability, and triggers, and how you actually can transform actually how you do that by modifying each of those actually factors. How do you change motivation of those involved? How do you change actually their ability to act, and what trigger you use to actually motivate them to act? And so I'll put that there for the groups that might find this interesting to continue evolving their great work.
Thank you so much. Moving on to Professor Roger Harrison. Dr. Harrison, if you remember, we had facilitated an open letter to the WHO Executive Board in 2020, specifically asking for strengthening youth engagement and a ring-fence fund for youth engagement initiatives. At that point of time, we had identified fund financing or funding or resources as one of the major barrier in kind of expanding the youth engagement initiatives globally. What do you think are the other barriers? Apart from funding, what are the other barriers in terms of expanding all these different initiatives across the globe, and how can we overcome them?
Well, thank you very much for giving me a rather tough question. And I concur with what has been said already, that I'm sat here feeling rather old and unenergetic compared with all the energy that the people have had who have been presenting so far. And just to agree with the other speakers, that I really hope you take back to your members just to show how absolutely incredible the work that you're doing is. And from someone who has tried to do this type of work myself, I know how much hard work, how much energy, how much inspiration has to go into it. And I agree to some extent that funding for anything is always an issue, isn't it? There's always a funding issue for anything, but things can still get done in certain ways. I found that the biggest challenge is, how do we get people interested in something that they don't know they need to be interested in? So we're sort of relying on people at the moment to come forward and say, I really understand why this is such a huge issue. I really get it. I really get why it's such a crisis. And you get a lot of people at the moment who they've either not heard of it, or they don't think it can be important. Otherwise, why would a doctor have given them antibiotics? And I think that's one of the challenges that needs to be overcome, this idea that we've got medical practitioners, clinicians who are still certain practices that they're still doing that we would rather that they didn't. And then we're trying to say to the patient or members of the public, you may have received something that you don't actually need, and receiving that is actually potentially causing harm for you and people elsewhere, but you'll never see it. And that's the other challenge. Compared to climate change, we can actually see that now. The climate in Manchester this year has just been bonkers. It's just like nothing that we normally get. And more people are accepting that that is due to climate change. I think the challenge with antimicrobial resistance is trying to inspire people to get them to grasp the seriousness of it. And I think we have a lot to learn from climate change and how people have been responding to that, because I don't understand myself why they're not responding to AMR in such a way. One of the challenges with students, and we've already heard, is that fortunately, they graduate and their priorities change. Their priorities then change to getting a job, to developing their career. And some of them do go into the field of AMR or into some sort of healthcare role where they can bring that in with them. So the idea of continuity is very difficult. And what I like from some of the presentations is that they haven't just looked at people going out and delivering messages. They've also been helping them to train in research, in project management, in lessons in how to communicate with members of the public. And I think the more it becomes more of an integrated package where people are developing wider skills which are really going to explicitly serve them when they go into employment, I think that will help. But the sustainability has to be part of the model that people are using right from the very beginning. And the other key thing I think is to show the reciprocity. You know, we need to give back to the students. You know, it's not just exciting, and you can learn a lot. I've learned a lot from going into schools. They ask you challenging questions, you know, the kids in schools, they're really great. But students need something in return. And they're not sort of, they're not a resource that we can just utilize without giving them anything back. And I think we have to look at, certainly for students in high schools or in undergraduate programs, in universities, what is it that they can formally receive back through doing what they're doing, which can also help boost their CV, you know, and show prospective employers, look at the value of what they've been doing. Look how important this is becoming to society.
I think, Dr. Harrison, you're absolutely right. You know, what do we give in return to the students? We excite them about antimicrobial resistance, and what are we able to give back to the students? That is a very, very important question that we need to answer. All of us together need to answer probably. Moving quickly on to Sean Williams, we want to get insights from a strategic funder in this space, Wellcome Trust. So you have supported several youth engagement initiatives, including YAR, I assume. So what do you expect as outcomes from this kind of strategic funding that you give to youth engagement initiatives? Sean, there's some problem with the audio. We're not able to hear you. I'm not sure whether it's only a problem from my side, but I'm not able to hear you. Okay, others are also noting. Sean, while you're figuring your audio out, I can quickly go to Alex Costa and then come back. Sure. So we have. Can you
hear me, Philip? Let's confirm that first. Can you hear me?
Yeah. Yes, loud and clear. Okay, I understand that it's early morning in New York, and sorry for waking you up so early, but okay. we are very glad to have you here. I think coming from UNICEF, you know, you have a long history of engaging young people on diverse issues, including HIV and even non-communicable diseases in some cases, and it's quite well accepted that youth do have a role to play in behavioral change, especially in community settings, and especially if you look at healthcare or nutrition decisions of a community. So what are the core competencies or positive behavior that we have to expect from young people when we engage them about antimicrobial resistance? I always tell people it's if you look at non-communicable diseases and schools, you can easily tell students, go tell your parents to exercise more and use less salt in your diet. These are two very crisp messages that you can pass on. But in the case of antimicrobial resistance, what are the competencies, or what is the essential list of things that they need to be aware about?
Well, so I would like to start by saying that, well, first of all, thank you very much for inviting me to participate in this event. I think this is an eye opener, especially when you have so many different youth groups involved in such an important cause, which, as we know, because we work on it, it's actually very critical, has been for a very long time, but we have not been able to get a lot of traction. I think we have more knowledge and understanding and awareness of the problem today than we have before, but it's still far from what it should be in order to really catalyze the political commitments and to allow us to mobilize resources to be able to support many of these important initiatives. The second point I actually want to make, which I think it refers to the competencies to a certain extent, is that I think we have to think of short-term and long-term interventions. And I think that there's a lot of short-term interventions that we are collectively trying to put in place in order to contain the emergence and the spread of antimicrobial resistance. But realistically, the sustainability of these long-term interventions depends on younger people. It depends on the level of awareness. As children grow up, it depends on the level of understanding of antimicrobial resistance among students and young adults and the next generation of professionals that will be involved in this. So even if it takes a long time, sometimes to see results, I think it is absolutely critical. And I think I fully support the initiatives that I've seen today. And I think coming back to your question in terms of the competencies that would be necessary, I would start by saying, and I think my introduction sort of alluded to this, I think persistence and a high level of tolerance to frustration is very important, because we've been trying to get traction on AMR for quite some time, and it's getting better, but far from what it's supposed to be. But I don't think we should stop. I think the persistence and this tolerance to frustration are very important. And you have to ally this, I think, to strategically thinking. I see a lot of creativity in the initiatives that were presented today. And I think that is very important. It's actually, you come in with a very creative mind, which happens very often with younger people, and also a very strategic way of thinking. You might try several different strategies that may not work, but that doesn't mean if you continue, that doesn't mean it's not going to work. I think, so strategically thinking is another one. The other thing is, as we know, this is a very complex problem. It's a One Health problem that involves several different sectors. It's also interdisciplinary. So we can't really achieve our collective goals unless we work in partnership and in collaboration with others. And I think that's a very important trait as well. Like, we have to step out of our silos, out of our vertical thinking, and start looking for ways in which we can work together, collaborate across sectors, across disciplines, across countries and continents, in order to really have the impact that we're looking for. And to achieve this, I think we have to be innovative. And I see a lot of innovation in what I'm seeing today. And I think that's much easier with younger people. Innovating and embracing change is much easier among younger people than some of the old folks like me in this call. And I think ultimately, we need an inherent drive to achieve results, to keep the eyes on the prize. What is it that we are trying to achieve? And just keep going and pushing until you actually start achieving those goals. I think collectively, that's what I think in terms of competencies that we actually need going forward. Over to you.
Well, I think you're very right. The persistence, the investment in time and energy and resources that we put in is very, very important. And staying invested is also quite important. As React Asia Pacific, we've been piloting something called Antibiotic Smart Communities. It's a long-running project for community engagement. We've selected one small community and then working with them for a long period of time. So again, the challenge has always been, how long will you stay invested? Because community engagement is not a short-term process, unfortunately, just like youth engagement. I can quickly go back to Sean Williams. Sean, is your audio issue sorted?
Can you hear me now?
Loud and clear.
Great. So you want me to, I can pick up that question you asked me before, and sorry, the technology was going far too smoothly. I'm sorry, it was me that messed it up. So as I was saying, or was trying to say before, thank you so much for inviting me to join today. As others have said, there's been so many inspiring presentations about different initiatives that are already happening. So I really hope that they continue. And as Philip was noting, welcome we're a major funder of global health initiatives based in London in the UK. And we have a strong program on public engagement, and we particularly also try and make sure that we bring youth in as a key group into our public engagement activity. Certainly in the AMR space, as everyone has noted, so I won't repeat it, they're a key group. People have already noted how much scope they have to create change. I think maybe the thing that we haven't touched on so much today is also how much children and youth are affected by AMR, as obviously everyone is, but young children particularly being especially vulnerable to effects of resistant infections. So sort of these dual reasons for why we should bring youth and children into the discussion as key stakeholders. So in terms of what Wellcome might expect from initiatives that we support and the outcomes we would be keen to see, I would touch on two things that I think are really relevant across the different kinds of projects that might be run, considering that, there's such a breadth of different programs that exist. The first thing I was thinking about in response to this question was producing something, whether it's a product or a program or some sort of initiative, whatever it is, but something that is really targeted to your specific audience, both in terms of the content produced and the approach. That's really something that we will be looking for and expecting to see. And as others have already noted, and I think many of the programs discussed are already doing this, whatever kind of work you're doing to be effective, it really has to be relevant and tailored to the group where you're aiming to engage, where you're aiming to create change. And obviously we know so much about how norms and cultures guide how we behave, how we understand the world around us. And so because of this, when it comes to engagement, what works for one group won't necessarily work for another group. And so we have to be really cognizant of this when we're designing programs, designing research, and designing the products that come out of them. And this is not just, we often think about this in terms of the differences between countries, something that works in one country not necessarily working for another. But I think when we think about children and youth as well, there's another angle on it here, right? What works for adults doesn't necessarily work for children, and even within the youth group, what works for teenagers won't work for young children necessarily. Maybe some things will, but we can't always assume that. So it's really breaking down who it is you're trying to target and making sure they're really your focus. And as well as the content being targeted to those groups, really thinking about the approach that you're using. And I think this is why it was so interesting hearing about so many different programs that are working in very different ways, because really to have impact, to hopefully have some sustainability, you'll also need to meet your audience where they are. Thinking about what mechanisms work best for them. What does a product have to look like to be really usable, to be something that people can pick up and bring into their daily lives? It's by making it accessible that we can really hope to, have long-term impact and create something that will be kept and used and have this sustainability element. And we talk about sustainability so much, but actually often it's really hard to achieve. And the second thing I wanted to touch on about what we'd really expect to see in programs that we support is actually involving the target group in the work and creating an open dialogue with them. And I think, again, so many of the projects discussed today are clearly doing this. Engaging your target community directly in the research, in the discussion, in the programs, but obviously in a safe and appropriate way, is just a really great way to test things out and make sure what you're doing actually is effective and accessible. You're not telling those people what it is they need or will actually find useful. You're asking them, you're making them part of the discussion. And through that, this is, tying back to my first point, through that's a great way to make sure you are producing something that's really tailored, really accessible, really usable. And not only that, but hopefully through that process, you're creating some real ownership of the project or program or product that you're creating, bringing that community into the discussion. And hopefully, again, this should, loop back into this point on sustainability, hopefully creating something that people can carry forward and say use beyond the term of one specific project, which is often the challenge we face if we're funding, say, shorter term pieces. How do you make sure that it goes beyond the very specific term we might be supporting?
I think that message was very, very clear. I think it cannot be a one-size-fits-all approach, and the socio-cultural adaptation is extremely relevant And second is what is a sustainability and scale up plan? That is quite interesting. We have only 8 minutes left as per our scheduled time. So can we go in for a second round of questions? If we can keep the responses to 1 to 2 minutes, we can finish in time. I'll go back to Dr. Thomas Joseph with a quick question on, I know that you have a background in tuberculosis, and in 2019, WHO had launched an initiative titled 1+1 to mobilize youth to end tuberculosis. Do you think it's a right time for a similar initiative on antimicrobial resistance issue? And do you broadly think that youth will be able to influence policy at the global and country level?
I think if we can start with the second one first. I mean, there is no question, but the evidence is clear that youth not only can, but they do. And I had given, the examples of Greta Thunberg's, brave and powerful speech, which shook the world really. But also Malala Yousafzai. And, it's not just these individuals, but institutions. So you mentioned the 1+1 TB sort of initiative, and, that is relatively recent, but it has still produced significant results in the sense that, I think it has reached out to thousands of people through just a handful of youth, and that's the important thing. The 1+1 is one person reaches one, and therefore you reach the world through that process. And I think that's a similar process. I remember that somebody else, yes, it was Moshe Michael, from Rollback, who had talked about, 300 children reaching 11,000 others. So, this mechanism works. There's no question about it. Is it time? It's overdue. I think until we get young people involved, and I think this is something that I feel is I should also be doing. I think it's time for WHO's AMR department to create a mechanism to engage youth better. And we can learn from what you are doing. We can learn from what others have been doing here. And I'm going to think about this so that we do it. So we are late, and so are the other institutions. We should be engaging youth, and we should be engaging them systematically. The global consultation talked about the primacy of youth as an audience. And again, I think it was again Moshe who talked about starting them young, because old people have behaviors that are set. So we need to change school curricula. We need to change curricula in pre-service curricula, whether it's for vets or whether it's for doctors or nurses or whoever. All healthcare workers need to understand AMR, engage with it, powerfully. And also teachers. I think that's something else that somebody mentioned. ASPIC Junior, I think, talked about training packages. All these we can learn from, we can build on, and we can try and multiply so that it goes across the world. So very quickly, yes, definitely, we are going to do something about it soon. Sujit is on our strategic technical advisory group, and he's going to help me do it. And we will set something up. Thank you.
It is very nice to hear that WHO is planning and there's something in the pipeline. We have so many other initiatives not represented on this platform. Even from the audience, we didn't have the time to actually give talking space to all of them. But there's a huge number of groups actually interested in kind of mobilizing students about antibiotic resistance. And one such great initiative is run by Professor Anthony Sof, basically the Innovate for AMR, which is now labeled as Innovate for Health. I just wanted to ask you quickly about your experience of conducting this Innovate for Health. And do you think the alumni has been successful in being catalysts to stimulate interest about AMR in the wider student community? Over to you, Dr. Anthony.
Thanks so much. Innovate for Health has been really, for us, one of the more motivating things we do each year, because it really has young people innovating actually and putting forward their ideas actually about how to take on the challenges of emerging infectious diseases. And of course, with COVID-19, we moved actually from an originally focused just on AMR to one more broadly, including COVID-19. But importantly, actually, teams of students, 2 to 5 students actually enrolled at university or graduate school levels put forward projects to address emerging infectious diseases. They do so in one of 3 innovation pillar areas: healthcare delivery, food systems or in the community environment. And we provide them just the tools to help nurture their ideas and to grow them and refine them. Problem objective trees, SWOT and stakeholder analyses, the kind of things that we dive into in our doctoral classes here. But actually, we also have added now coaches on behavior change and advocacy strategy as well. So these tools can only help nurture, of course, the start of oftentimes really promising ideas. But I do think we've seen some very promising signs of folks who've very carried it forward as catalysts in this area. I mean, we've only been around for 5 years total, including Innovate for AMR. If you add the 3 years now, the third year of Innovate for Health. But what we've already seen is really extraordinary in terms of where they focus on. For example, they focused on, in previous years, dairy cooperatives in India as a leverage point to affect changes in the antimicrobials among dairy farmers who may overuse actually antibiotics to treat presumed mastitis among actually cows. They've actually focused on refugee camps in Europe, on Aboriginal tribes in Australia, on hygiene in wet markets from Latin America to Asia. So their creativity is really unbounded. And importantly, they've gone on to win also awards afterwards. One won last year, a grant from the Royal Society of Tropical Medicine and Hygiene on rapid diagnostic test use in Nepal. She focused actually and won an award from FIND, which is the product of a partnership that works on diagnostics for their work. We've also had other teams come together afterwards, like to create a COVID-19 app from one of our earlier years of our actually competition. And importantly, some have gone on actually to publish articles, such as in the Frontiers of Public Health, on assessing the implementation of antimicrobial stewardship in health facilities under the National Action Plan in Tanzania. So we're seeing early results and that are very promising. And we're hoping, of course, that they'll continue to do more. But there's so much more to say, of course, about them. But I'll put in the chat actually a link to actually the competition, which closes this year's applications by September 19th. We would encourage many on the call here to consider applying. We really want to see the best and talented actually as part of our selected cohort to nurture this year in this cohort.
It's great to know about what students have achieved after the competition as a person who has been associated with the competition for the last 4 or 5 years. So quickly moving to Dr. Harrison, you've piloted or you've initiated several youth engagement or youth mobilization initiatives on AMR all across Africa, I would say. And what do you think about the sustainability aspects of these movements? Do you think funding is so critical that they will fold up when the external funding stops?
Not necessarily. As I said before, some of it depends on the inspiration of the students' aspirations when they finish university or when they leave high school. Some of it, I think, is due to the reciprocity element. What is it that they're getting from, investing their time, their energy in AMR, when, let's face it, there's so many other competing objectives. It's just that we think AMR is the most important, and it is, but students and other people, they might think coronary heart disease is the most important, or malaria might be the most important. So I think that's some of the challenge. And one of the challenges as well is in supporting those people. Universities, as an academic, I get very, very little credit for doing this type of work. My bosses want me to bring in lots of money and publish in the Lancet, whereas the type of work I'm doing, and establishing these smaller groups, smaller pilot groups in particular, will never achieve that. So I think mentoring is really important. I get students all over the world. I don't know how they've got my number. It must be written down, in a bathroom somewhere. I don't know, but students, I had 2 contacted me last night from Nepal. So I think they need mentoring. They need just general support and encouragement. But my plea, while Thomas and Sean here, is the funding made available has to be at 2 levels. These large-scale grants are fantastic. People like me who've tried to apply for them are often highly complex. They require universities to be involved, and they often have overheads, not always. But students and once they've joined the alumni, they're not in those positions. They're not going to fill out from masses, these very complex documents. So we need far more pots of small grants that are very simple to apply for, that may have a risk attached. Nothing might happen, but we have to take that risk, that small grants are vital, and they've got to be very simple for people to apply for. And I think that's a big plea, and that's a huge gap at the moment. And I know REACT have got some small grants. The Royal Society of Tropical Medicine, they do some small grants, but we've really got to push that forward. Otherwise, these students, they can't travel, they can't get to the schools, they can't afford their refreshments, they can't do any photocopying, you know. So what are we expecting them to do without these very, very basic resources? So I'm putting that to Thomas and Sean to take forward for us.
I think, Dr. Harrison, you're absolutely right. You know, our ASPIC Club initiative had launched something called ASPIC Seed Fund Program. It's not huge money. It's approximately $75. But then that actually resulted in a lot of additional activities, and because to fund for refreshments, you know, fund for a small banner or some publicity material, they need some money. And there's not huge money that we are talking about. I think the last question of the day to the funder in the group. Back to you, Sean. You've published the Reframing Resistance report, and you know, you've been very active in communicating about antimicrobial resistance using different strategies to the public. You know, as a science communicator, what do you think can excite children? Do you think AMR should be a part of the school curricula? Like, AMR is important for us because we all work in the AMR space, but not necessarily for everybody. There are much more visible issues out there. But do you think, how can we excite children, and do you think AMR should be a part of the school curriculum? Oh.
Definitely, and I don't have a AMR teddy bear behind me, unfortunately, but Dr. Harrison has one with him, so that's a great tactic. I won't speak much now about the reframing resistance work in the interest of time, but I'll share a link to it. I think we're really proud of having conducted that piece of work, and hopefully it provides some really helpful resources just to think a bit more about how we communicate about AMR, because it's something often we just assume we can do well, but is famously not always done very well. So it's just really useful to think a bit more about how we're going about things. So I'll share that that link. But I think in terms of how you can excite children and young people, unfortunately, the framing work we didn't look at youth as a specific group. It was sort of general public adults. But we came up with a few recommendations from that piece of work in how to talk about AMR effectively. And one I was thinking about that might really resonate with children is to emphasize that AMR is a universal issue that affects everyone, including you. And in the research, we found that it's important to show that anyone can be affected, that not only the most vulnerable groups and people in certain countries are affected, but it's really all encompassing. And to demonstrate that, which is particularly the bit that I think will be of interest, is we found that telling human stories was most effective, and sort of numbers and statistics generating less strongly. And so just really having this focus on people and what they're doing and how it's affecting them. And so I really think that could be a great way to reach children in particular, telling the stories of real people and not just patients, but also of doctors and nurses and other healthcare providers who are tackling AMR in their communities, and even scientists in the lab. And so many people have already spoken today about the role of youth as the leaders of tomorrow, and sort of showing them these roles that people already have and the positions they could take up. And I was wondering as well to myself if this could be a great way as well to really bring to life the One Health aspect of AMR, which is often far more abstract and quite difficult to understand. So how could you tell the stories of say, a farmer, or maybe even if we're working in children's stories, an animal or something like that? And then the final part of your question around should AMR be taught in school curricula, definitely, and it's great that I think in many places it's already featured. As so many people have pointed out, though, it's a complex issue, and so things need to be appropriately tailored to age group. And this is something that it's great to have had the Youth Against AMR project represented today that Wellcome supported, and they developed an education framework looking at what would be appropriate to teach children at what age, and sort of recognizing that at younger ages it's far more effective to teach about just what illnesses are, how to prevent them, what to do if you do get sick, and recognizing that just because we're not speaking about resistance specifically, we're still laying some great foundations that are really helpful for when these topics get introduced more specifically at a later stage. And a very last thought from me that in terms of how teaching could be done is ultimately, and speaking as a policy person particularly, so I have a vested interest in this side of things, it would be great if when we teach about subjects like this, that we don't just focus on the technical side. Obviously it's important, but we also think about actually what needs to happen, what we can do, that we teach about these things in a very solvable manner, and particularly point to how, say, big global issues like this need to be looked at by governments, how they involve the wider international community, how they involve people. And actually this taps into one of the other recommendations from our piece of work on framing, to encourage immediate action. And so if we can really focus on action, show how these things are solvable, and then we're taking great steps to, to create these leaders of tomorrow, which, as everyone has acknowledged, is just hugely important.
Thank you so much, Sean. I think those are relevant thoughts to actually end this panel discussion. We should create stories out of this, out of all the statistics that we are publishing, and also kind of keep it in the public domain for people to feel it. So I didn't take any Q&A from the Q&A box, questions from the Q&A box, because Dr. Sujit was answering it, and most of the questions were generic and it was not directed at any specific panelists. So I think thank you so much, all of you, for staying on for such a long time. I know all of you are busy people, and you have other more important stuff to attend to. I hope these presentations actually interested you, and also kind of sensitized you about the diversity in youth mobilization, youth engagement initiatives across the world. And now I hand over to Dr. Shruti Thomas, who's my colleague at React Asia Pacific. Over to you, Shruti.
Yeah, thank you. Thank you so much to each and every one of the panelists and our session moderator for that very information-packed session. Since we are a little over time, I give the stage to Dr. Sujit Sandhi for the final concluding remarks. Over to you, Sujit.
Thank you. Thanks very much. I'd like to end by thanking all the presenters, right from the first presentation, and Daniel, Michael, Ponari, Fong, Sudhika, Vishal, Haifa, Selvina. Excellent presentations, and as the panelists said, it gives the diversity and the length and breadth of what's been going on, and it's probably a sample. There are obviously other groups which we haven't seen from or heard from today, but they're there, out there. It gives hope to the youth that they can do things which with limited resources and different diverse contexts. A special thanks to all the panelists, Roger, Thomas, Alex, Sean, and Anthony, from their diverse perspectives, but also articulating very clearly from their own experiences how AMR and the interventions and some of the strategies need to be for the youth, and also what it holds from a youth perspective in the future. I'd like to also thank actually the RAP members, that is Shruti, Philip, Vishal, and Haifa and Jaya for organizing this program. I think it has been very useful, and I hope that this is a platform for all of us who are listening to this to be able to move forward as a collective initiative with AMR in youth. And last but not the least, I'd like to thank the participants. There were, as I counted, around 120 at the peak, and I always feel that youth programs should not exceed more than 2 hours, and luckily we're just reaching that time. I just taught a medical students class in the morning today, and usually by around 45 minutes, people lose their attention. And so I think we've been on track, but may I end by quoting the fact that the youth of today are the leaders of tomorrow. And youth is not a number that can be counted with birthday candles. You are as young as you feel, and every moment of life offers new opportunities. So for those of you who are young at heart, it's not just physical age. Your ideas, your stimulation, the way you lead a community, all give that enthusiasm of mindful youth. And I think that is very important as we tackle AMR. Last but not the least, I think the power of youth is the commonwealth for the entire world. And in a crisis such as AMR, where we really have ineffective antibiotics and patients and communities are really suffering, I think you can give that spark which is needed with innovative ideas, as long as you understand and have an emotional connect with the whole issue of AMR. So with that, I'd like to thank everybody. I'd like to thank all of you for spending your last 2 hours here with us. And let's hope this is the beginning of a collective, resurgent, youthful AMR initiative. Thank you very much. Shruti, I think we can just do the closing remarks and close. Thank you very much.
I think Dr. Pujit has covered everything. Thank you all. Thank you all for spending your time here. Special thanks to the panelists and to each and every presenter who took the time to prepare. So thank you, and hope to see you all in another event another time.